Good morning, good afternoon, everyone. My name is Dr. Mary Nyangasi. I'm a medical doctor by profession, a global health physician in the oncology space, a policy expert and preventive oncologist, currently serving as the head of the National Cancer Control Program at the Ministry of Health in Kenya. So I will take you through my project, which is about empowering primary healthcare providers for early diagnosis of cancer using digital e-learning platforms. So my project, when I look at this image that I'm about to share with you, is about disrupting the normal. When you look at my experience, I have witnessed many patients presenting late for cancer treatment, not because they did not come early, but they came early but interacted with the health system severally, where the health worker is treating them for other conditions. And by the time a diagnosis of cancer is made, it's usually too late. So for me, this image is about disruption. It shows diversity, meaning all of us have a role to play in prevention and control of cancer. It shows presence, resilience, and being purposeful, really being daring and seeking to make a difference and being bold for impact. So my project really seeks to change the stereotype around cancer among healthcare providers, where it is thought that a certain cadre is what is supposed to manage, or rather to be able to even detect cancers. It seeks to sensitize the health workers about their role in prevention of cancer, early diagnosis, and referral for further management. So when you look at the reason why this project is important, as you may be aware, there's a rising burden of cancer within our setting and even globally. And what we see in Kenya is that there are poor outcomes because of late stage presentation. Cancer is actually a leading cause of premature deaths. And this project for me is also very, very important because I have witnessed that in our setting, cancer is disproportionately affecting women. So we have breast cancer and cervical cancer as the leading types of cancer, and we see more women being affected by cancer in our setting. And so the stereotypes and stigma that exist are contributing to health inequities among women and also a lot of suffering. So we look at the primary health care provider as the point of interaction with the majority of clients, and making a difference at that level will be able to bring in a huge difference in terms of empowering them and enabling early cancer diagnosis and referral. So this is my theory of change. By addressing poor health outcomes, inequities, stigma, and stereotypes at the primary healthcare level, we will provide these health workers access to free e-learning materials. And we'll motivate them by providing them with CPD points and certificates so that they can continuously onboard and learn. This way, we'll reduce premature mortalities. Actually, we know that for breast and cervical cancer, it affects mostly women between 35 to 50 years of age. And so it's significantly contributing to premature mortality. Addressing this will help the country achieve the Sustainable Development Goal 3.4 on reducing mortality due to premature deaths of NCDs by 30% by 2030. We'll also be able to avert 30% of deaths from cancer and 40% of cancer being prevented from occurring. So how is this going to be done, or rather, how have we done it? I have had workshops where I've convened the experts to create content, which we have worked with content developers to upload on the digital learning platforms. So far, we have this content on the Ministry of Health Virtual Academy, as well as the M-Saratani application, where they can be able to download this material and learn about cancer at their free time. Initially, there was resistance, of course, because mostly trainings like this are associated with physical training where health workers can earn some daily subsistence allowance. But gradually, through negotiation and showing the importance of this, platforms, we've been able to see a gradual increase in the onboarding rates. And so far, for example, in the last 3 months, we've seen about 1,571 health workers onboarding these platforms and learning about cancer. So we hope that we'll be able to conduct evaluation to see the change in practice over time. So what's the future of these platforms? We seek to improve these platforms by introducing a mentorship section and also to strengthen the active discussion forums so that we can have more and more interactions within the platforms. Thank you for listening to me.